So still on the Rcgp Sca sample cases, the 6th sample case on the Rcgp website for the SC exam preparation is as follows. The patient's name is Christine Davis, and she's coming because she's forgetting things. So forgetfulness is the presenting complaint. Instructions to candidate. Christine Davis, 47 years old. She had normal smear 3 years ago. IUS in situ inserted 1 year ago. Her pregnancies were 21 and 23 years ago. So two previous pregnancies. NHS health check 2 years ago. She had a health check 2 years ago. Her blood pressure was 122/67. Her BMI was 25. Her Q risk 2 years ago was 1.8. So low Q risk, BMI of 25, just borderline between normal and overweight. Normal blood pressure 122/67 2 years ago. She's never smoked tobacco. So it looks like from her information, she's low risk essentially for cardiovascular problems. Questions for discussion and notes. Is there any helpful information in the case notes to read before starting the consultation? She's 47. So she's young, she's fairly young, but you should bear in mind she's female, she's 47. So she could be perimenopausal or even postmenopausal. Okay, once she's from 45, you should start thinking menopause or perimenopause. Okay, so she's 47. If she's still having her periods, there's a possibility she could be in perimenopause. If she's no longer getting her periods, of course, she had an IUS inserted a year ago. Find out if she's been amenorrheic since having her IUS inserted and now she's having forgetfulness. You begin to think, is there a chance she's amenorrheic simply because she has an IUS, or is she now amenorrheic because she has gone into menopause? At that stage, you might want to be requesting, a serum FSH level to guide your decision making and to guide your diagnosis. Overall, she's fairly low risk for cardiovascular problems. And that thing to note is her BMI is borderline. It's just at the margin between normal and overweight. In fact, 25, I think normal ends at 24.9. So 25 is the lower limit of she being overweight. So you have to have that in mind, that you might need to encourage some weight management for her to just be conscious of not putting on more weight. What might be the cause of Christine Davis's symptoms? So her presenting complex forgetfulness, it's likely perimenopause. Maybe she's having brain fogs, depleting estrogen levels, declining estrogen levels, probably developing some possible brain fogs. You need to ask about other perimenopause or menopausal symptoms like hot flushes, irritability. She's already having forgetfulness, difficulty in concentration, any vaginal dryness, any recurrent UTIs, things like that. So you need to be asking those kind of questions. Tiredness, brain fogs. You also need to be wondering, could she be having a vitamin deficiency, for instance, folic acid deficiency, vitamin B12 deficiency? Could she be having some thyroid imbalances, hypo or hyperthyroidism? So you need to be thinking about all of those that can also cause troubles with memory. She's worried. How might you explore that? I can see you're worried about these troubles with forgetting things. Is there anything in particular that worries you? Is there anything in particular you were hoping I would do to help? Explore her concerns, explore her expectations. Are there anything you've noticed you're struggling to do because of these forgetfulness? What are her priorities? And how might these be incorporated into your actions and explanations? With a symptom like memory loss, with multiple possible causes, how do GPs effectively focus our time for data gathering? So forgetfulness is like headache. It can be so vast. There's so many things that can cause it. It can be nutritional deficiency. It can be early onset, dementia. It could be menopause or perimenopause. It could be hypo or hyperthyroidism. It could be delirium from an infection, from an infective inflammatory process. So you need to eat. There's just so much it could be depression. You see, it could be depression, low mood, it could be anxiety. It could be undiagnosed ADHD, undiagnosed autism. So she could be really distracted and having inattention. So you need to. It's just a lot that can be causing memory loss. Just a minute. Let's put on the do not disturb. There we go. Should a GP cog, as a GP assessment of cognition tests, should a GP cog or other brief memory assessment be completed? Other ones like the things like the 6 seats cognition assessment tests. You might not really do a 6-seat or a GP cog as a screening test, but those relevant questions, the questions you need to be exploring are impacts, psychological impacts of this memory loss, social impacts, risk assessment. Is she driving? Is she at risk of having a car crash? If she carries on driving, is she forgetting things that could potentially be very dangerous? She's forgetting to lock the door. Is she forgetting to turn off the hob, the electric hob or the gas cooker? For instance, is she forgetting to turn on her heating? How heating, is she at risk of hypothermia? Is she at risk of wandering, getting lost? These are risk assessments. She could get lost in the winter and die of hypothermia. She could get frozen outside. So these are things that you need to be doing. Risk assessment, impact. Okay, what are the things she's forgetting to do? How is it affecting her? Those are the things. And then you could do some questions like, I'll ask you a few questions to give me a clue, more clue as to how this is affecting. You could ask her the time, the date, the month, the year. You could tell her to count backwards from 20 to 1, those kind of things. You can tell her to count backwards the months of the year from December going backwards to January. Those kind of, just briefly assess those things, but you might not be giving scores at that point in time in the exam. How do you ensure the patient is safe or evaluate risk? Exactly what we've just said. Risk assessment. If someone is losing their memory, there's a possibility that they could be forgetting to turn on or turn off the cooking gas, the herb, electric herb, cooking herb. They could be forgetting to turn off their gas heating, thereby putting them at risk of having so much bills, for instance. They will be forgetting to turn on the heating, putting them at risk of hypothermia. They might be forgetting their driving routes. They might be forgetting things that's, dangerous corners where they need to slow down. And all of those can put them at risk of having car crashes or accidents. So you need to be exploring their risk. They might have taken certain medications and they will forget that they've taken it and they'll take another one. You know what I mean? So risk of overdose, so risk assessment. Is there any advice you might offer about how she can manage her symptoms or optimize her health? So the good thing is that she's low risk for any cardiovascular problems, low Q risk of 1.8. You'll be thinking you need to do some blood tests to check for reversible or correctable causes of memory loss. So you do some thyroid function, diabetes screening, kidney, liver function, check her folic acid, ferritin, vitamin B12, do all of those. And then you would arrange another appointment where you go through this GP cognition assessment of cognition, GP cog, formally, and you complete that assessment and come up with a score that will be documented. You advise her that her weight isn't bad. Her BMI, which is her weight relative to her height, is 25. So we tell her that's a warning sign that if she carries on putting more weight, then she might have troubles with her overall health. So she needs to be mindful. She probably needs to exercise more, watch her diet, more healthy diet. If she's smoking, she's never smoked, so let's go check how much alcohol she's drinking. If she's drinking more than 14 units, you need to be advising for her to be drinking not more than 14 units in a week, and things like that. Exercise can improve her mood, can improve her memory. You need to probably do an FSH to see if she's perimenopausal or menopausal. You probably need to give her an information leaflet to, where she can read more about menopause and HRT, because she might need it. Does uncertainty about the cause of her symptoms remain at the end? It's a possibility that in the first consultation, if she's having hot flushes, for instance, hot sweats, night sweat, hot flushes, then you start thinking, oh, I'm suspecting this could be related to menopause. Maybe you're approaching the menopause, and we need to be thinking about hormone replacement therapy. But I think we need to do some blood tests, to check your hormone level. It will give us more clue as to whether you're already in the menopause, whether you're in perimenopause, which means you're around the menopause. So we need to be explaining that as well. How might you communicate uncertainty to these patients, if so? So if you're not yet sure, you say, I'm thinking, could this be this? Or could there be something else? I want us to run a series of blood tests, and let's also, at a later date, formally, thoroughly, go through a set of questions and come up with a score that will give us a clue as to the impact of this memory loss and what could potentially be causing it. And then when we meet again with the results of your blood test, we can then discuss what next needs to be done, if we need to be referring you to the memory clinic for further assessment, or if we need to be thinking maybe this is menopause or perimenopause, and then we'll be talking about HRT. So explaining how things will go, in your next appointment is also important. What might you plan to do next? Exactly what we said. Do some blood tests. Add FSH into that. Give her some information links or information sheets or leaflets to read on HRT, to read on forgetfulness. Ask her to come in with someone else, maybe a partner, or a daughter, son, someone who knows a lot about her and can give further information about her risk assessment as well, and the impact this memory loss is having on her life in general. So you can always invite her to come with someone. So you can also advise her to keep a symptom diary of things that she's forgotten from that point in time till when next you're following her with her investigation results. You advise her not to drive until this memory loss has been fully assessed, and then until we are sure it's safe to drive. I'll advise you in the meantime to avoid driving, just because carrying on driving with memory problems can put you at risk and can also put other road users at risk of accidents. What are your thoughts on this? Do you think you want to hold off driving in the meantime? Check what she thinks. She might tell you, oh no, doctor, I can't afford not to drive, and she'll explain her reasons. And you also need to explain your reason. Usually it's an exam. The actors are reasonable. If you explain nicely and reasonably, they will accept not to drive. Usually, hopefully. Well, we hope that the patient doesn't start screaming and shouting. The purpose of this case is to explore memory loss. It is unclear as to the exact cause of the symptoms. There may be aspects of cognitive decline. However, menopause may be contributory, as may anxiety and overwork. So impacts, what's her job? She might be so stressed and she's just blanking out, because anxiety, burnout can actually give you brain blocks and brain fogs. An examination including memory assessment and investigations, including blood tests, would be helpful next steps. So helpful next steps. Examination including memory assessments, investigations. I need to check her blood pressure again because the last one was 2 years ago. Make sure she's not having high raised blood pressure, high risk of having all these micro infarcts in the brain. Patient-centered acknowledgement of uncertainty is important. You need to be able to say, okay, at this point in time, it's not very clear as to why you're having memory loss. But hopefully, with further investigations, things will begin to become clearer as to what exactly could be causing this. So you're giving that hope and optimism that it might not be so clear as to exactly what's causing this, but let's do some investigations. Let's keep you safe in the meantime. If you think there's low mood, depression, you're talking about CBT, advising her to self-refer to the psychological therapist for CBT. And another point, obviously, you'll also be discussing the option of antidepressants if depression is a likely cause of her memory loss. You need to be thinking about that. So that's the end of this particular Rcgp sample case. Wish you all the best in your exam. Cheers, guys.